Hi, everyone. I'm so excited you have joined us for this final wellness week on Wednesdays. We've done this for 6 weeks. Alex Sauvé, Sabrina Winder, and myself. And this is probably my most favorite subject. So I know a lot of you are like, okay, I'm curious. I know I myself was at Pilates this morning, which Erin and I both are certified Pilates instructors. And I was at Pilates this morning, and a physical therapist also teaches my class there. And there's a lot of physical therapists in the class, which is really fun. There she is. There's my teacher from this morning, Carrie, also a physical therapist. And so I just love that this talk amongst women, especially, like, you need to have a hormone doctor and you need to have a pelvic floor physical therapist, because I'm going to give you a little bit of my story. 30 years ago, 30 years ago next year. So my goodness, I have been out of physical therapy school for 29 years. I still run around with all my physical therapy friends, but I will tell you this. 30 years ago, there was a woman by the name of Cheryl Wazinski. She was like leading the way in women's health. And back then, it was doing Kegels, was pelvic floor, and using vaginal cones. Sorry if we have small ears or men and they want to laugh at that word, but using vaginal cones to do squats. Like, that was all we could tell patients to do, and there was just nothing really out there. So I love that I still have my hand in physical therapy. I help teach at UNMC. One of my running friends and running partners back from Lincoln is involved in that program and leads the gerontology program there. So I do get to have my hand in with students, and I love how much awareness is in pelvic floor. So why I ended up in pelvic floor and going to Erin, and I call her a healer, and I mean that in all the sense. And I float my time between Erin and Carrie on here, because Carrie dry needles me and takes care of me. But Erin is she's a pelvic floor, certified pelvic floor physical therapist. And what happened to me is, runner out the day of Christmas, meeting my friends early in the morning, slipped on a little ice, never fell, just like zipped up my inner thighs, right? Used my adductor, and I literally tweaked my obturator internus, which is a really deep, Erin's going to talk about that, deep pelvic floor muscle. It
Mhm.
killed and it killed and it presented in lots of different ways, but it hurt so bad. And clearly, who is going to work on that area, right? So I waited forever and ever to see Erin, and it was worth the wait, because I don't ever want to go off her list again. But I'm going to share a little bit of how she ended up in pelvic floor, and then just educate you, because I really do feel, and amongst us national vice presidents in Arbonne, and I mean this, a lot of them have spoken to Erin. I've put her on the phone with a lot of them, but I truly believe that every person should have a pelvic floor physical therapist, every person. And so I'm going to turn it over to Erin and just give her the spotlight. I still have my degree. I still keep my licensing up and all the fun things. I don't practice full time. There are times where I'm like, oh, I could help women in such a big way. And Erin knows that. Sometimes I leave and I'm like, okay, I'm just going to go through all the pelvic floor credentialing. And then I get used to my life as an entrepreneur, and I'm like, okay, maybe next time. But I love Erin. You're going to love her as well. And I'm going to turn it over to her so she can share with you all the greatest things and how she ended up in pelvic floor.
Okay. Awesome. Thank you so much, Molly, for having me. It is an honor to be able to share with you guys and to be here with you. And this is a topic that I am very passionate about, and just something that I wish that I could just stand on the rooftops and scream it to anyone who will listen to me. And so, thank you so much for having me. It's exciting for me to be here and to be able to share. But just a little bit about myself. Again, my name is Erin Kotick, and I live here in a small town outside of Lincoln, Bennett, Nebraska. And my husband and I have 4 kids, Reese, Paisley, Reagan, and Jeter, spanning from the ages of 6 now to 13. And I have been a PT since 2012. I started my career actually as a Pilates instructor first, and then to PT. And after I went to school with the school. I career taught and saw was a practitioner of like primarily outpatient orthopedics, and I would see patients of all ages. I think my youngest patient was maybe 5, all the way up to I treated a 99-year-old, and did a lot of post-op and loved athletes. I played volleyball in college and was a four-sport athlete in high school, and so sports has always been such a big part of my life, that I would say primarily athletics is primarily what I saw, but I saw the gamut of everything. And just kind of like Molly, I knew that women's health and pelvic floor therapy was out there. But about halfway into my career, I really started just noticing. I would see a lot of low back pain, hip pain, pelvic area issues, and it just I felt like I was helping my clients, I was helping my patients, but there always seemed to be like there's just maybe something that was missing. And after I had my fourth child, I had 3 vaginal deliveries, and of course Jeter, my little guy, 3 girls and a boy, ended up having a C-section, and decided after him that I wanted to start going through the coursework for pelvic rehab. And it was at the course where we were actually assessing each other, where I realized, oh my goodness, I had no idea that I was having pelvic floor dysfunction until I was being assessed and learning the things and going to the bathroom and being like, oh my gosh, I had no idea that I had dysfunction. And it was really then that I was like, I could not wait to get back into the clinic and start working with my clients. Um, and so that's kind of how I got my start. And so now I've been doing pelvic floor therapy for now 6 or 7 years. About 5 years ago, I switched from the very busy outpatient orthopedic clinic that I was at and opened my own practice. And now I own Inspire Life Physical Therapy, which is a strictly cash-based physical therapy clinic, and it's just myself. And I am out of network with insurance, and it has been just a really good balance for me and my family. And through that process, um, I see about 20 patients a week, 20 hours a week of patient care, just so I can properly take care of my family too and have the flexibility. But through that process, I realized that my time, I wanted to be able to bring this to more than just the client that's right in front of me. And so a colleague and I developed an online program. It's a 21-day pelvic floor breathing series, which is 21 days of exercises that are 8 to 10 minutes each day, and to try to be able to bring the education far and wide. And so we developed Breathing Core and Pelvic Floor, this online series 2 years ago. And it has been a joy to be able to bring this to more women and be able to educate and help people. And then also through that process, I've been able to work with lots of lots of women. Right now, I would say I see a lot of athletes, high school and collegiate athletes is a piece of what I see right now, to be able to help with athletic performance too. And so it's been really fun to be able to not just treat symptoms, but also to be able to help enhance performance for athletes. And so that's just a little bit about me and how I got my start. And just try to give a picture of like why I'm so passionate about it, because um, I think there's a lot of people out there that maybe have dysfunction and don't even realize it, and don't realize that it may be inhibiting being able to increase your max or be able to run an extra mile, or specifically like athletes. I think there's it's hindering performance a lot. And a lot of my clients, they would say, man, I've had this chronic hamstring issue, I've had this chronic low back issue for years and years and years, and then all of a sudden we start addressing the pelvic floor, and it helps the situation. So yeah.
And I'm going to interject here. I
Yeah.
swear, if you know anyone with a labral tear, I feel like everyone should. This is because I'm a runner, and my whole network is runners. Is
Hmm.
everyone should see a pelvic floor physical therapist before they go to surgery? Like
Yeah.
my sister-in-law just reached out to me and said, they found out I actually have a labral tear, and I had sent her because of the wait time for Aaron, I just was like, just go see my friend Kelly. And Kelly did great, and she got to go to London and walk and all that. But now the pain is back, and I was
Hmm.
like, do not go to surgery, please,
Hmm.
please, please go and see a pelvic floor. And so one thing I do want to be outspoken about, my sister was like, oh my gosh, but yes, it does involve an internal examination. Duh.
Hmm. Yeah.
But I had significant, all my stuff is on the right hamstring tear, the nerve sheath, everything, and all my weakness is on the right.
Hmm.
I was so unbalanced, left versus right.
Hmm.
And there's so much you can do for your pelvis. It's not just stretching and strengthening exercise,
Yeah.
for sure.
Yeah. Yeah, I'm really glad that you brought that up because, yeah, a lot of times people will be like, well, what do you mean it's an internal exam? I do have my pelvic model here just to be able to explain because a lot of times people are like, okay, what is the pelvic floor? What does that even entail? And so I do just want to give you a picture of the pelvic floor. The pelvic floor is really made up of a lot of muscles, just like our biceps, our triceps, our upper traps, our, all these muscles here, same type of muscles, but they're very deep within our pelvis. So if you look deep within here, you can see all of these muscles. This is all a part of the pelvic floor. There's three layers of your pelvic floor. Uh-oh.
There we go.
Are
There
we
we go.
good?
We're good.
Okay. Sorry. Okay, and then here is the back part of the pelvic floor muscles. But a lot of times, another really popular injury that I would see would be like piriformis pain. And, we would hit the piriformis, we would Graston, we would cup, we would dry needle, all this stuff. And then all of a sudden it was like, okay, we needed to get deeper. And some of these muscles, the only way that you can reach these muscles is intervaginally. And, and kind of the way I like to explain it is you have 11 muscles that make up your pelvic floor. And they all, the different layers coincides with the depth of how deep they are. Okay, so your first layer of pelvic floor muscles goes to about your first knuckle right here. That's the depth of your first layer of pelvic floor muscles. Your second layer of pelvic floor muscles goes to like your second knuckle. And then third layer would be third knuckle. So in order to get to that obturator internus muscle that Molly's talking about, the one that rotates your hip, you have to go intervaginally to be able to reach those muscles. And then a lot of times, you guys, I have numerous stories where I will do an internal exam, palpate, feel these tight areas, lengthen those muscles, have my client breathe through these issues so they can feel where the muscle is and allow their brain to connect. Okay, that's the muscle she's talking about. I need to relax or lengthen that. They get off the table, they feel completely different. They will text me later and be like, I was able to empty my bladder so much easier than I was before. I was able to have intercourse with no pain. I've always had pain with intercourse, and now I don't have pain. I can insert a tampon without issues, stuff like that, that is such a big deal, you guys, such a big deal to daily living. And that's why it's just really, it's a really important topic to discuss.
And Erin, talk a little bit about, I know for me, like I used an internal scraper. Um,
Hmm.
I mean, to put it mildly, like, and it does, I mean, if I get tight, if I start to get that hamstring wonky pain, it is just like a little wand and you
Yeah.
insert it and you scrape. And I can tell a difference in probably 2 minutes. So
Yes.
I feel like, again, every person should have a pelvic floor physical therapist. There she is. There she is.
Yeah. So I will actually show you kind of what she's talking about and try to reiterate why this is important. A lot of times people have this perception that if they have pelvic floor dysfunction, it is that, or if they're having any incontinence like involuntary leaking of urine, um, or bowels, that it is just a weakness in their muscles. And a lot of times, more often than not, it's actually a problem of too much tightness within those muscles that create a weakness. It becomes symptomatic where they can't use those muscles because they're already being used all the time. It would be like if you hold your fist, everybody hold your fist super tight as you can, and keep squeezing as I'm talking. And I want you to pay attention. Like right now, at first, when you first squeeze, it's kind of like, okay, that's kind of uncomfortable. I have my nails kind of like poking into my hand. But as you continue to hold and squeeze really, really tight, you will start to forget that you're holding this tight just like this. I want you to keep squeezing, and I'm going to show you why this is a problem over time, because this could be over months, this could be over years that we've been holding our muscles this tight, and it creates, yep, and a lot of times, I mean, I have treated 60, 70-year olds that were like, I don't know that you can fix this has been like this forever. It is teaching your muscles how to lengthen, and then all of a sudden our pelvis is functioning the way it's supposed to function. And so if you hold your muscles this tight all the time, those muscles become hypertonic, which means they become shortened, and then we can't use them the way we need to use them. And then a lot of times that's when we start to have the leaking symptoms and issues with reaching orgasm, and just a lot of pain symptoms is what I see. And so after you hold here, and we've only held for like a minute. If you open your hand and you had to try to reach something really quickly, you can see, okay, my fingers aren't working the way they're supposed to. Those muscles aren't as quick as they normally should be. And so if you do that over months and years, it can create a lot of issues. But if we learn how to lengthen those muscles, um, and this is the pelvic wand that Molly was referring to. There's three different wands that you can use. This is just the basic one, but there's also one that are temperature regulated where you can warm them up or cool them down. And then also one that has just like a little vibrating e-stim on the end, so that when you feel a trigger point, a muscular trigger point, just like you would in a pec or an upper trap or a bicep, you can hit that e-stim and then hit it right onto that muscle to release it, so that then we have more length. So when we need to, we can shorten and lengthen, shorten and lengthen. So yes, this is the pelvic wand.
I'm
And
gonna
there's also, go ahead.
I was gonna say, and this is huge for those of you that are lifting, right? Like a deep squat for Aaron, even, and I'm a physical therapist for Pete's sake, but I didn't know how to squat without that fist, to lengthen. She, like teaching me to lengthen. I'm like, my brain, it was like retraining my brain.
Mhm. Yeah, for sure. I'm glad you brought that up too, because it was just a fun thing that happened with a university that I was working with, a volleyball team, where we started to implement these pelvic floor breathing exercises to this team. And the coach had told me, I don't know what you're doing, but I can tell you that as we are testing verticals, these girls are jumping out of the gym like they've never jumped before. And I truly believe it's because we're allowing our muscles to be able to lengthen, and then you are able to recruit them and contract. And so, like increased vertical, and just like you said before, um, if you're like a squat, being able to squat, if we're constantly trying to contract, then we're not going to be able to have the power that we need for a squat. And you could be creating impingement and pain at the same time. Another thing that was like an aha moment for me was I don't know if anybody has heard the phrase like mom butt. Like you have all these kids, and then all of a sudden, like what happened to my butt? You know, it starts to contract or come down. Well, what happens is over time, as we continue to contract and tighten down your glute muscles, your pelvis starts to shift and reorient in this position that makes it appear like it's flat. But if we can reorient, then we can get the length and then have the strength again. And it's just a matter of figuring out how to lengthen those glutes and how to reorient your pelvis.
And I swear I'm almost 55 and I feel like, oh my gosh, that was it. People are like, you're running your butt off. And I'm like, no, I'm not. But I needed to learn how to lengthen my
Yes.
pelvic floor so that I could get that tiny bit of curvature back.
Yeah, for sure. Um, yeah, the other thing I just kind of wanted to point out too, if you don't have a pelvic floor physical therapist in your area, um, there's so many things that you can do and learn, like through the online course I touch on, and Jess and I both touch on just the importance of really committing to some sort of breathing program within your daily workout is so hugely important, and be able to connect a breathing program to your pelvis. As soon as you can do that on a regular basis, it's going to unlock things that you didn't even realize needed unlocked. And if you're not on any sort of breathing program for your nervous system, I would say it's so important. We talk so much about parasympathetic nervous system and the importance of our systems are so used to being on fight or flight. This sympathetic nervous system just go, 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 go. And bringing in the parasympathetics through a breathing program is so hugely important in the fast-paced world that we're all trying to live in. So connecting breath work with your pelvis is, if there's anything that you get out of today, that would be the one thing that I say is we got to learn how to retrain our breath because over time in the stressful world that we live, we've really created some bad habits within our breathing. Would you agree, Molly?
I absolutely 100%. And I know I even did a focused yoga retreat in March, and I thought I was going to pass out in one of the breathing things. And I even, again, background education wise, no, but at first it feels like I'm getting lightheaded, but it just tells you how much stuff gets stuck when you're breathing. But I want you to say, how do they find your program? Number one, and then
Yep.
I'll type in the chat because I know I have it, but
Okay, I will. Is it okay if I just send you an email
yeah,
or with the link to it? Because I don't have
yes.
it here just right on top. But yes, I will send a link to Molly, and it will go right to my website, so you can read a little bit more about me, and then right there you can click into. To the link to be able to access the program. Like I said, it's 21 days of exercises, and each day kind of builds on the next day. Each day also shows like anatomical pictures, so you know, excuse me, exactly what muscle we're referring to, and then it has like a daily focus for the day. Okay, today here's where we really want you to focus on this throughout the day, and then the next day we kind of repeat. Here's what you learned yesterday. Here's going to be your focus for today, and it is more than just breathing and pelvic floor work. You're going to work on recruiting your core muscles properly and how to connect your core, your abdominals with your pelvic floor muscles, and then also a lot of glute activation because we know that glutes are so important to avoid injury. And if you already have injuries, strengthening the glutes is going to be a piece of it or should be a piece of it. And so it's called breathing core and pelvic floor. And there's a lot of just really good strengthening exercises in there and modifications. So if there's some things that you can't do, we talk a lot about modifying there. And so, yes, I will make sure that Molly gets that link and I will get that
And
information out.
if you have your website name, type it in there, Erin, at
Oh
least.
yeah. Oh yeah.
And then one thing I will say, one thing that Erin taught me is I know, and I know there's a lot of my friends in Arbonne that feel the same way, but the just in case.
Ooh.
If you, how many of you do that before you leave your house? You're like, well, just in case. I see Kayla raising her hand. I know everyone's like me, just in case. I will go to the bathroom just in case because what if I get in a car accident or what if, and I wet my pants or something like that? Like, that's always what I'm thinking. Like, I don't have to go, but I've got a good 30-minute drive. This was me this morning. I've got 30 minutes until I run. So I drank a tea and a fizz. So I probably am going to arrive and have to go to the bathroom. Well, just in case I'll go. And she is like, no, unless you have a continuous stream for 10 seconds, like one Mississippi or however you count to 10, if it's happy
Mm,
birthday, whatever you do. Do you want to talk about that, Erin? Because I think
I
that's
do.
huge for a lot of us that we do that.
Yes, because
Good.
this for me was this this was actually the thing at the course where I didn't think I had any issue. I was here to help other people. And then they talked about this just in case peeing and no power peeing. And then they dismissed us to go to the bathroom. And I sat down and I was like, this is me. I am the problem. The no power peeing was a big one. Also, fast-paced world, we're used to being in and out. Kids are waiting for us, patients waiting for us. I know myself and a lot of my patients will sit down and pee as fast as they possibly can and push it out, and that causes a lot of problems and dysfunction within your pelvic floor. So it's really important to not power pee, to take big breaths and allow the urine to just come and let the stream come. And like Molly said, normal time, if you're counting 1/1000th, would be between 8 and 12 seconds. So If you are way under that, pushing it out in 4 seconds, you're probably power peeing. You'll know. You'll be able to sit in a public restroom now and know if the person next to you is power peeing. You can tell. Um, I kind of want to slide a card underneath the stall and be like, just kidding. But the no power peeing is a big one. And then the just in case. The reason why the just in case peeing is so important is that there's such a complex series of events that happens when your bladder fills to a certain level and then sends a signal to our brain that says, okay, I'm full. Now I need to go to the bathroom. If we're constantly going to the bathroom before we reach that level, then our brain gets confused and says, okay, now my bladder's not full, but it's at this level and I'm used to having to go at this level. It really can confuse this complex talking between your bladder and your pelvis and the brain and the central nervous system. So I would say it's very, very important that you wait till you feel the urge and then go, and then no power peeing. Um, and then at the very end, this was another thing that helped me. It took a while. It took probably, like, I would say 4 to 6 weeks till I really started at fully emptying my bladder. I didn't realize I wasn't fully emptying, but at the very end, after you empty your bladder, I always encourage people to like put your hands around your ribs. Let's see if you can see me. And then you're going to try to take an inhale through the web of your hands. You're going to take an inhale and think of relaxing your pelvic floor. So inhale, and then exhale, just further let go. And I encourage you to take 5 big deep breaths and see if more urine comes out. When I first started doing that, every inhale, I would feel more urine come out, like little drips. And then my next inhale, more urine, more urine. And then you can train yourself to all of the urine will come out of the bladder, which is a really big deal if you feel like you deal with increased frequency. So I'm glad
Coughing
you brought
too
that up.
hard and wetting your pants.
What's that?
Coughing too hard and wetting your pants. That was a question.
Yes. Yeah, my first thing would be that can be helped for sure. It's not something that you have to live with, and highly encourage you to get assessed. That'd be the number one thing. Because it could be a matter of that your muscles are just too tight so that when you cough hard, you have nothing to go to because it's already too tight. That could be, it could also be a weakness in those muscles too, not being able to contract. I'd say far more often I see it the other direction. But there's so many things that we could teach you to be able to, okay, if you can tell that like a sneeze is coming, you could do a quick squeeze and lift before it comes. But a lot of it is making sure that your resting tone in those muscles is at a good length so that when you do cough hard, you can contract and hold. But so much help for that, and it's not something that you have to live with, or this is just the way it is. And I will say I've had clients that have had one session and we get them on a good program and they don't have issues anymore. Good question.
Yeah, that's definitely, you guys, if you want to type something else that you have question wise, but that's something I definitely loved about Erin. It wasn't that I had to go like typical physical therapy. And I say this about Carrie too. It's not 3 times a week for 4 weeks or 6 weeks. It is once a week. I think when I was really, really bad, I think I could maybe every other week I came in for just like 3 weeks every other week. So that took 6 weeks. And then I was down to like, now I go once a month, once every other month. I just don't ever want to get off her schedule because
Hmm.
she's worth it. She's worth it. So that is,
Yeah.
yeah, I agree. People say
I
it's normal.
I
Yes.
thought of something else
Ah,
that I really want to make sure that I hit. If there is any like scars that you have on your abdomen or pelvis, um, like a lot of times people will think, well, if I haven't had a vaginal delivery, then I'm not going to have any pelvic floor dysfunction. I see just as much with C-sections than I do with vaginal deliveries. I would say it's very common in both. And like I said, I see lots of dysfunction in women who haven't had babies. Um, 16-year-olds that are playing sports like crazy that are having just as much dysfunction. So it's not just this vaginal delivery thing, but I will say another, if you're having symptoms and you also have any scar tissue anywhere on your body, specifically, I would say your abdomen and your pelvis or your hips. I would highly encourage you to see somebody to work on the scar tissue and then retrain the pelvic floor. Because a lot of times the scarring can really affect your ability to contract your core and your pelvic floor. And so a lot of times releasing that with a Graston tool, metal tools, or cupping or needling can make such a difference. And if you feel like I've done core work my whole life and I cannot feel my core fire, okay, hit the scars and then readdress. And I'd be really curious if you feel a difference, because a lot of times I'll say, okay, try to contract your core, try to contract this muscle. Remember what that feels like. We then do our treatment session, we do it again. It feels completely different. So that's another thing I would encourage.
Yes. And I think the question about you're driving home and you're a minute away, truly, I think to me, and Erin, you can answer this, it's reframing, it's breathing.
Yep.
Um, that 21-day breath work, it's worth its weight in gold, friends. If you're all on here,
Mhm.
do go to Inspire, and I'll make sure that this is in there, but inspirelife.co for
Yep.
company, Inspire, Inspire life, life.co. Can they reach you that way too, Erin? Because I know a lot of
Yeah.
people say, can I, and
Yeah. I'm going to put my
a lot
phone
of my
number on
friends
here.
to Erin, and she can see you virtually, as far
Yeah.
as, you know,
I'm going to put my phone number in here too.
yeah, do. Thank you. I was like, I always like when people like, can I have your pill? I'm like, I don't know, Erin, can I? Can I give
Yeah.
you a number? But
Yes.
I think that breathing for you is a huge thing. I can't say enough things about Erin literally worked so tirelessly on that program, and it's so good. When I say she did pelvic floor, when I looked into even getting certified, it was hours and hours and hours and hours and hours and hours and a lot of it sells out, which is awesome, a lot of the courses. And of course nothing is close in the Midwest, so you're like flying to Kentucky for 5 days and then back home, and it's extensive, it's very extensive. So her training is incredible, and again, I can't say enough good things about, it's not just wetting your pants, it's not just doing double unders. And I know I CrossFit for a while, and everyone just thought it was normal, including physicians that I worked out with that are friends would be like, oh, I just have a pee towel beneath me during double unders. I'm like, that's not good. Like, that's not you. No, that's not good
Mm, yeah.
at all. So, a good place to start, I would say, for anybody on here would be the inspirelife.co for the 21-day breathing. Like, start there. We all need to know how to breathe for sure.
Hmm. Yep.
And then, I'm just looking through the comments too as you are sitting here. Um, yeah, well, good. I'm glad. Yesy, that sounds good. Yes. Any other questions, friends? Carrie, do you have anything being a PT?
I don't think so. Very good. Oh, sorry.
Good, 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 good. I'm like, you might, but you guys, thank you. Thank you for dialing in. And this would be one that I would definitely share with people. I'm passionate about hormones and pelvic floor, and it's amazing how different you will feel with
Mhm.
everything. Um, with everything. The fact that I don't get on a plane and panic, most of my panic attacks on a plane were because of the bathroom, right? Like, I know I'm gonna have to go to the bathroom, the seatbelt thing is gonna be on, they're not gonna let me go. What am I gonna do? And I went down. It sounds like the dumbest thing ever. But I did. I mean, I would stress out so bad about that traveling. I've been married 32 years, and my husband knows, just make sure Molly knows where the bathroom is at all times, wherever she
Mhm.
is. And
Yeah.
it calms me down. I just need to know it's there. That's all.
Yeah. I guess I can kind of leave it with this too, because I thought this was really good. I learned it at my first course that I was like, I've been doing that wrong with my children. But a lot of it is just like allowing your brain to know that you don't like that you're safe. You have the control, and just continually repeating, like, I do have control. You don't have to go. You have the control, and just continuing to tell your brain that you have the control. You have the strength to be able to get there. And I remember they were saying, like when your kid comes up to you and says, "I have to go potty. I'm gonna go pee myself." What do we say? We're like, "Run, run, 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 go, 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 go," which is the exact opposite of what we should be saying. We should say, "Nope. you got control. It's okay. Take your time, walk yourself to the bathroom. You can do it. But then we get this hurry up, hurry up, hurry up, and then we lose the control. Where it's like the whole time, no, you have the control. You just have to remind your brain to tell the muscles, I have the control. So that was a good little thing too.
That is very good. Very, very good. I love that. So, well, thank you, everybody. Thanks for hopping on, you guys. I know you learned a lot. Please reach out to me, but Erin shared her number there, um, and in the website, and I'll make sure that everyone with the recording, because I had about 1 million people ask for the recording. But thank you so much for dialing in, and go get yourself a great pelvic floor physical therapist. It'll make a world of difference. So, thank you, everybody. Thanks. Make it a
Thanks,
great
Molly.
Wednesday. Bye.
Bye.